You're listening to the section on Medical Education podcast, brought to you by the American Thoracic Society.
Welcome to a podcast hosted by American Thoracic Society and our section on medical education. My name is Rachel Quaney. I am a medical educator at University of Colorado, and I am super excited to have a guest here with me, Jeremy Richards. He is serving as our chair of the section on medical education, and we are going to talk to you about this 2025 International Conference. So welcome, Jeremy.
It is amazing to be here with you, Rachel, and amazing to be able to talk about all of the incredible medical education programming we have at ATS 2025 in beautiful San Francisco.
Yes, let's talk about it. So I am looking forward to a lot of things. I have the pleasure of being one of the people involved in the section on medical education roadmap that, if people are not aware of, we put out every year to sort of give you a little guidance as medical educators combing through the program and figuring out what is of utmost importance for you to prioritize when you're making your schedule. So with being involved in creating this roadmap, I've had the privilege of looking through this program, and I would love to talk about some of the section on medical education sponsored sessions to look forward to this year. Jeremy, which ones are you most looking forward to?
Well, it's hard to choose the best ones because they're all amazing and we love them each equally. But for those of you who are interested in section on medical education sponsored programming, we have 3 sessions, all of which occur at 10:45 a.m. Pacific Standard Time, all of which the location is still to be determined. So please check back for that. And all of which, one more time, are absolutely amazing. On Sunday, May 18th, we're very excited to be able to present a session titled Being the Change, an allyship tool for clinicians, educators, and researchers. Again, that's 10:45 a.m., location TBD, on Sunday, May 18th, Being the Change. Rachel, I don't know about you, but I think that session would be amazing.
I think it's amazing. And I think what I'm most excited about is they are bringing a model that is created outside of medical education, an allyship toolkit that then they are applying into healthcare. And so I think this is a really data-based, evidence-proven session and framework that they are delivering to us. So I am super excited to attend this one and learn from these amazing educators.
Agreed. And hopefully all of the people listening to this podcast will be able to come by at 10:45 a.m. I keep saying it, but we want you to know on Sunday for that session. And if that sounds good to you, then you're going to love what we have on Monday, May 19th, 10:45 a.m., location to be determined, which is titled Dual Duties, Healthcare Providers as Caregivers. And again, this is extremely topical for so many of us who have, say, aging parents, who have extended duties beyond our work-related obligations, and gets us into thinking about, sort of our dual role as both family, friend, caregiver, as well as a provider. And this speaks to us both in medical education and in clinical practice. I think that one on Monday, May 19th, called Dual Duties, Healthcare Providers as Caregivers at 10:45 a.m. will be amazing. And I'll keep going. The one on Tuesday, May 20th at 10:45 a.m. that the section on medical education is sponsoring is titled Mythbusters, Debunking Mentorship Myths from the Mentee's Perspective. I think that sounds great. What do you think, Rachel?
I could not agree more. And again, at 10:45, I will definitely be going to these sessions. The healthcare providers as caregivers was an interesting session to help develop for programming because it was the most sought after session. We had people that were fighting over being a part of this session because it's clearly of utmost importance to us in all of our roles. And so, like Jeremy alluded to, the sandwich generation, this people that may have young children, they may have aging parents, they have extended family, they have a lot of hats. How do we optimize our roles, our both all of our duties. Also, this is not just for people that have those duties. This is also for leaders and medical educators. How do we support those people in our divisions, those colleagues? How do we build the systems required to make sure that we can support them and we can support educational needs, clinical needs, etc., with all of these competing duties that are occurring? And so I think that one I'm really excited about, how topical it is, and how excited everyone was for it. And then, yeah, Tuesday, 10:45, Mythbusters. So this one was put forth by a mentee who said, I don't know what I'm doing. How do I find a mentor? How do I be a good mentee? What are all these myths? What are all these scary monsters that I'm supposed to tackle? And that was the impetus for this session. And so I think that's such a unique perspective of saying, hey, this is something we need. Let's do it. Let's find the people that can speak to this from a variety of different perspectives, from trainee, early career to very established mentor. And I just think there's going to be a variety of pearls coming from this session that I'm super excited about. And I think as educators, this is something that we need to be tuned in. What are the myths that our trainees are hearing of that we may not even know of? What are they thinking? What are they scared of? What do we need to be mitigating for them? So yes, again, these 3 Section on Medical Education sponsored sessions, Sunday, Monday, and Tuesday at 10:45 Pacific time, should be amazing, and I hope to see you all there.
Exactly. We hope to see lots of people there. And one way to get there, in case you're listening to this and you're saying, but the location is to be determined. How am I going to get there? Well, first, you can download the ATS conference app and have that available as a tool to help keep up with where the different sessions are as the room locations become available. And or you can use the program, the official program from the ATS. And if you're doing that, we're going to go through these sessions super quick one more time with an additional little nugget of information that might be helpful for you. And if you're a pen and paper kind of person, you might want to write this down. If you're a thumbs and keyboard kind of person, you might want to note this in your notes. But these sessions have little call numbers, as many conference presentations do. And so on Sunday, May 18th, Being the Change, an allyship tool for clinicians, educators, and researchers, has the call number. Are you ready to write this down?
I am.
Of M as in Mary, E as in Edgar, 101. So that's ME 101. Said better, M as in medical, E as in education, 101, ME 101. On Monday, May 19th, the session that we have called Dual Duties, Healthcare Providers as Caregivers, is ME 102. And you're all very bright and astute, and you probably figured out that on Tuesday, the 3rd session, Mythbusters, Debunking Mentorship Myths from a Mentee's Perspective, is ME 103.
Fantastic.
But Rachel, that's not all. We've got more sessions for people interested in medical education at ATS 2025, wouldn't you say? And they're not just presentations, right? They are kind of networking, socializing, community building sessions so that people can get to know each other in a very engaging, dynamic, and fluid manner. And one of those first sessions that we have for people is something called the Networking Exchange for Early Career Professionals. What's that all about?
So this is a welcoming event for early career professionals. And the nice thing is there is a very fluid definition to this, right? So if anyone feels like they would benefit from networking with early career professionals, come one, come all. Join us at 5:30 to 6:30 p.m. Pacific time, Moscone Center South Terrace. So that is going to be the South Building, level 3. And it is a welcoming event that includes cocktails and appetizers amongst your colleagues, your friends, ready to network and mingle.
And if you can't make the networking exchange for early career professionals, which, by the way, tends to be a really big event with lots of people, lots of excitement. It's a kickoff for the ATS 2025 international conference, particularly for young people, such as many of our trainees and early career educators. If you can't make that, then we encourage you to come the next evening on Sunday, May 18th, to the Section on Medical Education business meeting. Yes, that's right. The business meeting is in the evening at 7:15 p.m. The location is the notorious to be announced or to be determined location. And this is another opportunity to learn more about the Section on Medical Education, as well as network, engage, and work with other interested medical educators within the American Thoracic Society. If you are interested in medical education and you would like to get involved with this aspect of the ATS, you really should come to the Section on Medical Education business meeting, 7:15 p.m., Sunday, May 18th. Be there. We'd love to see you.
Absolutely. So we alluded a little bit to myths earlier. I think this is a good time to call out any sort of concerns about the business meeting. This really is open to everyone. So you can be a trainee, you can be early educator, mid-career. You can be any part of your career, know all of the people, know none of the people. Please come and to this business meeting, and we would love to see you. So there's some sort of informational time, there's some networking time, and please don't hesitate. We would love to see everyone.
But Rachel, a business meeting sounds so boring. Why would I want to go to a business meeting when I could go out and enjoy San Francisco at 7:15 p.m.? I'm just going to sit there and listen to somebody like show me PowerPoint slides and talk at me. I don't want that.
That will not be the content of this business meeting, and there's food and drinks provided.
Amazing. And I think we'll layer on one more time in case you missed it with all the exciting aspects of the business meeting. It is interactive. There is some content delivery about what's going on at SoME, and then there's an opportunity for people to engage with each other within the community, within the group, to work through some questions and some things that we need to think about in the section on medical education. This is not your standard boring sit there and fall asleep business meeting. This is the SoME business meeting. All right, if you can't make the networking exchange for early career professionals on Saturday and you can't make the business meeting on Sunday, is there any other opportunity for you to go to some sort of community building, sort of networking event at ATS 2025, Rachel?
Why, yes. Yes, there is. Conveniently, on Monday, May 19th at 4 p.m. Pacific, there will be what we know affectionately as the Teach networking event. So this is an event that has been hosted for several years now by the Trainees Interested in Medical Education Time Group. So it is a group of go-getting trainees interested in medical education who put on this exciting event that also has food and drinks for you at 4 p.m. And this will be in the Moscone Center Networking Super Center. So come one, come all to the Teach networking event on Monday, May 19th at 4 p.m. We'd love to see you there.
Yeah, no, great. It's also a very fun event. Lots of opportunity for engagement, focused on trainees, obviously, and early career professionals. And last but not least, in terms of the section on medical education, associated or sponsored or affiliated networking events on Tuesday, May 20th. That's right, one every day, Saturday, Sunday, Monday, Tuesday. There is the International Medical Group session in the Networking Super Center at 3 p.m., which is a consistently wonderful session for all, whether you are an IMG, FMG, an international medical educator, or based in the United States. This is a fantastic opportunity to interact in a dynamic and engaging manner with people who are really devoted to medical education, who are excited about building global connections and to influencing medical education around the world. And this event is always well attended. It's always dynamic, and it's always a great opportunity to meet new people who are kind, caring, supportive, and excited about medical education around the world. So, quick recap. On Saturday, we've got the networking exchange for early career professionals. Make sure that that is on your calendars. And just again, Rachel, so that people don't forget it, when is that?
That one is on Saturday, May 17th at 5:30 p.m. in Moscone Center South, level 3, the terrace.
be there. That is going to be quite an event. We always love the networking exchange for early career professionals. And on Sunday at 7:15 p.m. in, again, location TBD, we have the section on medical education business meeting. Again, not your standard boring business meeting. This is a dynamic event with food, drinks, interaction, community building, and welcoming and a welcoming environment for you, the early career professional or young medical educator. And on Monday, May 19th, do we have any events again? Remind me, it's the Teach event, right?
Oh, yes, we have the Teach event on Monday, May 19th. And that is at 4 p.m. in the Networking Super Center. So we would love to have you at 1, 2, or all 3 of those amazing social events.
And finally, again, the IMG International Medical Group session on Tuesday, May 20th at 3 p.m. is the last one that we would highlight here. There's a lot more in terms of medical education associated programming at ATS 2025. And if you're curious to see the extent of what's out there, we would strongly encourage you to get the roadmap for medical education that we have put together from the section on medical education. Rachel, anything else that we want to highlight from this program for our listeners, viewers, and other audience members?
No, I really just want to reiterate the value of this roadmap, because there are quite a few amazing sessions that we were able to include in the roadmap but can't cover here. And so please take a look at that and see if anything appeals to you. And we would I'd be happy to answer any questions if you have them as well.
Fantastic. And then we get one question that we do get frequently is, hey, this all sounds amazing. How can I be part of this community? How can I be part of the section on medical education? And I think our number one response to that would be, please try to come to the business meeting. Again, Sunday, May 18th at 7:15 p.m. in location TBD, and just start to meet people, introduce yourself, let us know that you're interested, show up, be present, be brave, and say hello to people. And indicate your interest. And that is a great way to get your foot in the door, demonstrate your interest, and start to become a part of all of the planning and organization and activities that take place in the section on medical education. Is there anything else, Rachel, that we want to tell our listeners about getting ready for, preparing for the international conference so that they can have as successful an experience as possible?
Absolutely. Besides the amazing advice that you just gave, I think the advice I would give is just set aside some time to plan your conference. There are so many options, and it can be very overwhelming, especially if ATS is new to you, and you want to go in with a game plan. And so set a little time aside to look at the roadmap, to put things on your calendar, to download the app, look at the program, and just think through either what your concrete strategy is, or at least a rough strategy of the sessions that you want to hit. And that's a really good time to flag all the amazing ones we talked about today onto your calendar, so we can see you there. And then what Jeremy said, when you go to these sessions, don't hesitate, speak up, get involved, introduce yourselves, especially in the world of medical educators. I like to think that we are very approachable, and we would love to meet you all.
We are definitely approachable. We would love to meet you all. We'd love to see you at these great events.
On behalf of myself, Rachel Quaney, Jeremy Richards, and the section on medical education, we thank you all for taking the time to listen. And we look forward to seeing you at ATS International Conference 2025.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more podcasts from the ATS assemblies on YouTube. Don't forget to like, comment, and subscribe so you never miss a show.